Hello friends, welcome back to Romedics. This lecture is on fracture type. What is fracture? Fracture, it is a medical condition in which there is a damage in the continuity of bone, which means broken bone. Break in any bone in the body is called fracture. It is caused by direct blow, crushing force, sudden twisting motion and extreme muscle contraction. Now the classification of fracture based on etiology, traumatic fracture, pathological fracture and stress fracture. Based on soft tissue involvement or with external environment, closed fracture and open fracture. It is also called as compound fracture. Based on the displacement, non-displaced fracture and displaced fracture. Based on the fracture pattern, linear fracture, transverse fracture, oblique fracture, spiral fracture, impacted fracture and avulsion fracture. Based on the fragment, it is incomplete fracture and complete fracture. Based on the etiology, the fracture is classified into traumatic fracture, stress fracture and pathological fracture. First, traumatic fracture. It is due to trauma. For example, fall, fight or road traffic accident. It causes fracture, so we call it as traumatic fracture. Stress fracture. It is due to severe stress to the bone that leads to fracture on the bone. So that is called stress fracture. For example, March fracture. March fracture means it does not come in the March month, but it is due to march past or severe work to the leg or severe work to the foot that leads to fracture in the bones. For example, army mans, police, dancers, athletes, players, they are doing heavy work with the leg, right? So that leads to break in the bone. That is stress fracture. Pathological fracture, it occurred through an area of diseased bone, which means a diseased bone is already weak, right? So that leads to break in the bone. So that is called pathological fracture. Here, no trauma, no stress. It is due to other underlying condition. So it is called as pathological fracture. These are the pathological conditions. Now, based on the soft tissue involvement, closed fracture and open fracture are there. Closed fracture is also called as simple fracture. Open fracture is also called as compound fracture. Closed fracture. It does not cause break in the skin. So the fracture is present within the soft tissue. That is closed fracture. Now open fracture. It is also called as complex fracture and compound fracture. The open fracture, it causes a break in the soft tissue, which means communication between external environment and the fracture. Now the grades of open fracture. Grade 1 is clean wound with less than 1 cm long. Grade 2, larger wound damage without extensive soft tissue damage. Grade 3, that highly contaminated area, it has extensive soft tissue damage, which means it is a most severe condition. Now, based on the displacement, here non-displaced fracture and displaced fracture are there. Non-displaced fracture means the bone is broken but the bone fragments does not move apart. So they are closely present. So that is called non-displaced fracture. There is no movement between two fragments of the bone. Displaced fracture. The movement of bone is present, which means the bone is moved to nearby area. So that is called displaced fracture. The displaced bone fragment override the other bone fragment. So the displaced fracture requires surgery to repair. Now, based on the fragment, complete fracture and incomplete fracture. Complete fracture, which means the break across the entire cross section of the bone. So it is called complete fracture. The complete fracture is present here. And incomplete fracture, the fracture does not complete. The part of bone is break in the part of bone. So break across through only part of the cross section of bone. According to the anatomical placement and fracture pattern, Greenstick fracture, linear fracture, now we are going to see that kind of fractures. First, Greenstick fracture. It usually takes place during infancy or childhood. Okay, if you take a green stick and break that stick, what will happen? One end is bent and another end is broken like this, right? Likewise, this green stick fracture also. The baby's bones are most fragile, right? So, if in a severe bend in this bone, that leads to one side of the bone is broken. So, this type of fracture is called green stick fracture. Linear fracture. the fracture line which is parallel to the long axis of the bone. This is the long axis of bone. This fracture line is also parallel to the long axis of bone. So it is called linear fracture. Transverse fracture, the fracture line which is perpendicular to the long axis of the bone. This is the long axis of bone. This fracture line is perpendicular to the long axis of bone. So it is transverse fracture. Oblique fracture, in which the fracture line is oblique to the long axis of bone or diagonal to the long axis of bone. There is a long axis of bone and the fracture line is diagonal to the long axis of bone. Spiral fracture, it is also called as torsion fracture. If the two ends of bones are twisted in the different direction, then that leads to spiral fracture. Compound fracture, a fracture in which the bone is sticking through the soft tissue. So it is a open fracture, right? The open fracture is also called as compound fracture. Comminuted fracture, if the broken bone part is more than 3 pieces, then it is called as comminuted fracture. Look at this, here 1, 2, 3 pieces are there. So it is called as comminuted fracture. Particularly it is common in aged people. Why it is common in aged people? Maybe they have osteoporosis or some other underlying conditions, or their bones are less density of calcium. So that leads to more brittle, easily breakable, and it is repaired with pins and wires are connected between the pieces of bone. It must be immobilized so that it may heal quickly. Compression fracture, the fracture caused by the compression, act of pressing together. So this bone going to fracture, right? So it is the compression fracture. Compression fracture of vertebrae are especially common with osteoporosis people. Avulsion fracture, the fracture which occurs when a fragment of bone tear away from the main mass of bone. How it happens? Normally, ligament and muscle tendons are attached with the bone, right? So if any severe contraction in the muscle or movement in the ligament that pull the bone, then it's going to fracture. That is the avulsion fracture. Impacted fracture, the both ends of bone fragments are impacted, which means damaged. So it is called as impacted fracture. Impact in between the two fragments of bone. Depressed fracture, the fracture in which the fragments are driven inward. The bones are going to invert to the body. So it is commonly seen in skull fracture or facial fracture. Thanks for watching.